Hello, my name is Ashley. I am in a CNA course right now. This video is going to be on how to care for your catheter. Unfortunately, I do not have a person to help be my model here, so I'm just going to be doing it without. Thank you. Knock, knock. Hi there, my name is Ashley. I'm going to be your CNA today. We're going to be cleaning your catheter. After I introduce myself, put my hand sanitizer on, covering all hand surfaces, let it dry, close the curtain for privacy. All right, I'm going to raise my patient's bed up till it's at a comfortable level for me, okay? So, at that point, I'm going to put my gloves on. Get my supplies. Alright, so I've got my washcloths, my towels here. Just gonna get some warm water. Alright. Ask the patient if this water is at a good temperature for them. If it is, you can go ahead and continue. I would probably have a table here that I would have all this stuff on, okay? So, first, with your patient, you're going to want to take your bath cover and place it over them until you hit the point where you're pretty much where your hip bones are, okay? And you would actually, we would do a fan fold with the blanket. So, patient's covered here. You've got your blanket pulled back, only exposing the area that you need. And then you take another towel and you're just going to ask your patient if they are able to raise their butt up just a little bit. If they can't, that's fine too. Basically, you just want to take the towel and go underneath their, or in between their legs, right up where the catheter comes and the hose comes out, okay? So just to cover from the patient having to get wet or get a mess anywhere or get the bed wet, all right? So now that we have our setup, I'm going to take my first washcloth, get it wet in my warm water, okay? Put some soap on it, nice and full of soap. Then you first want to clean the urethra, the area at the base of where the catheter is, all right? Flip this over. You always want to do a new side when you're coming back to wipe again. Now, I'm going to hold basically where the catheter is coming out at the base, just kind of like hold the line right there to make sure that it's not moving or getting pulled at all. And from there, I'm going to clean all the way. I'm going to go about 4 inches out, okay? So I'm going to flip it one more time and just kind of make sure that I'm like twisting all around, getting it nice and clean. So now that we have the catheter clean, and actually I missed a step. Before you would start this, right when you're basically raising the patient up, I forgot to check my catheter line. So that's something that you want to do. You want to make sure that the urine is still being able to run down the line, that it's not clogged up anywhere, okay? So I've already cleaned the catheter. We got our soapy washcloth. I'll just kind of keep that there. I'm going to take a second washcloth, get it full of warm water, rinse it. No soap this time because this is going to be our rinse, okay? So first we want to rinse the base, and flip to the other side, hold it, rinse the catheter, the wire part, flip again, do one more nice rinse, All right, now that we have our catheter clean, we can take that. We can take our towel out since the patient is nice and dry. All right. Kind of take their bath cover off. Place their blanket back on them. I'm going to take all my materials. All right. I'm going to throw all of my towels into a hamper. I'm going to take my basin, dump the water, rinse it a couple times, okay? Dump that, dry it off, put it back in my supply closet right away, okay? I'm going to come back to the patient. All right, thank you so much. Here's your call light, okay? I'm going to sanitize my hands again. I'm going to lower the bed all the way down. I'm going to pull the curtain back. And that's it. Thank you.